The domestic ferret, Mustela putorius furo, whose Latin name means stinky thief, has enjoyed a slow but steady increase in popularity as a pet over the past 15 years. It's important to remember that this small creature is a distinctly different species from its wild and endangered cousin, Mustela nigripes, the black-footed ferret. Although some people mistakenly believe they own black-footed ferrets, the fact is that nigripes exists only in a small area of Wyoming and in a very few zoos. There is no individual ownership of black-footed ferrets. The individuals you see at play here are a good representation of the common domestic ferret doing what they do best. There are an estimated 6 million pet ferrets in the U.S., but in most practices they are still considered exotic animals. Unfortunately, most small animal veterinarians know very little about basic medical care, diagnostic procedures, or surgery of these animals. Consequently, mistakes may be made every day that can be life-threatening to ferret patients. For a good working knowledge of ferret care, it's essential to master the correct techniques for physical exam, venipuncture, intravenous and urinary catheter placement, general anesthesia, and even euthanasia. It is the intent of this video to provide clear, simple, and practical methods for increasing your competence and clinical confidence with this species. Each section will begin with a list of necessary equipment and will then show you step by step how to accomplish each procedure. The video may be viewed in its entirety or watched in sections to be learned and practiced as your ability increases. The only things you need for this are a small room, ophthalmoscope, pediatric stethoscope, and 2 cotton-tip swabs. The first step of the exam is to allow the ferret to walk and explore as any normal ferret would. By doing this, you may observe whether its locomotion and general attitude are normal. They will often immediately go to a corner to urinate and defecate, allowing you the opportunity to see if the urine and stool are normal color and consistency. Look at the hair coat. Is it full and thick, or is the hair beginning to thin on the flanks, shoulders, or tail? This could be a sign of poor nutrition or early adrenal disease. What ferret owners often call rat tail syndrome is almost always one of these 2 problems. Now check the skin for mast cell tumors. Although these are always benign, they can cause local irritation, bleeding, and crustiness. Look for any abnormal nasal discharge. Examine the eyes for cataracts or corneal scratches. Check the ears to see if there is excessive wax or a crusty exudate that might indicate the presence of ear mites. If there is any doubt about ear mites, they can easily be seen on a slide just as in dogs and cats. Check the maxillary and submandibular lymph nodes. These should not be palpable. Proceed to palpate the prescapular and the popliteal lymph nodes as well. Then scruff the ferret and lay it on its back. Nearly all ferrets will yawn after 15 to 20 seconds in this position, allowing you a good view of the teeth, palate, and tonsils. Ferrets are susceptible to periodontal disease, necessitating dental cleaning and polishing. Examine the vulva in females and the prepuce in males. Vulvar swelling in spayed females can indicate the onset of adrenal disease, and lumps or swelling around the prepuce of males can indicate the presence of preputial gland adenomas. Abdominal palpation is very important. The spleen in a healthy ferret may be small, about the size of an index finger, and felt on the left side just posterior to the last rib. Large spleens may be present in healthy normal ferrets and are not a cause for alarm. As long as the spleen is not so large as to impinge on other abdominal organs and is normal shape and consistency, it may be considered within normal limits. Palpable lumps or irregularities of shape or consistency warrant further investigation. The stomach is not normally palpable. It sits protected by the ribs. In gastric or pyloric obstructions, the stomach may be filled with gas and palpated posterior to the ribs. Both kidneys should be palpable. As in most mammals, the right one lies slightly anterior to the left. Even in severe clinical adrenal disease, the adrenal glands will not be palpable. A diseased adrenal gland may be anywhere from 3 millimeters in diameter up to 4 centimeters. Likewise, insulinomas are not generally palpable unless they are extremely large. Most active insulinomas are only a few millimeters in diameter. Finally, auscult the chest. Breath sounds should be audible on both sides. Lack of normal sounds could mean the presence of fluid or a thoracic mass. both fairly common in ferrets with lymphoma or heartworms. The heart should have two normal sounds, just as in dogs and cats. Murmurs may be present due to heartworm disease, anemia, or valve defects. I cannot overemphasize the importance of the physical exam and knowing what's normal and what's not. Perform a physical exam on every normal ferret that comes into your practice. Ask ferret owners to bring in healthy ferrets so you can examine them. It's also very important to listen to ferret owners when they describe behavior they see as unusual. Most ferret owners are quite observant and very much in touch with their ferret's normal behavior. Apart from a thorough physical examination, being able to easily obtain a blood sample is the most important part of diagnosis. Primitive methods like nail clipping simply don't allow a large enough sample to perform many tests and are quite traumatic for both patient and owner. Anesthetizing sick or debilitated patients for jugular puncture creates unnecessary additional risk. What we're showing you here is a simple, safe method for cranial vena cava puncture that we have used for 15 years. I have done this on thousands of ferrets and demonstrated it to many veterinarians, students, and technicians without any serious complications. For this procedure, you will need a lavender and red top microtainer, 25 gauge needle, 1 cc syringe, alcohol, ferritone, and a good ferret restrainer. The ferret holder and the phlebotomist stand on opposite sides of the table. The holder grips the ferret by the scruff of the neck as close to the ears as possible. Gripping too hard and pulling the skin of the lower neck and chest too tightly will make it more difficult to obtain a good sample. The holder then lays the patient on its back with the nose pointing toward the person holding the syringe. The holder's wrist is slightly elevated to push the chest of the patient upward and present it squarely. The other hand of the holder may be used to restrain the front feet or to administer ferritone if necessary. Find the manubrium with your index finger. This is the marker for your entry point. Position the needle and syringe about 1 centimeter lateral to the manubrium and with the needle pointed at about a 45-degree angle downward, medial, and posterior relative to the patient. The needle is pushed through the skin to the hub. Then a vacuum is applied as the needle is slowly backed out. When blood begins to flow into the syringe, simply hold it steady until the desired amount is obtained. If you miss the vein, pull the needle out, replace it, and try again. Ferret skin is very tough, and one stick usually dulls the needle. There are two important safety precautions. One, the ferret must be held tightly in order to prevent flailing, and two, the needle should never be moved in a circular or side-to-side fashion to find the vein. Either of these problems could increase the chance of tearing the vein. Ferrets who flail their feet or try to bite often may be calmed by offering a little ferritone. I suggest you practice this venipuncture technique a few times on an anesthetized patient, but you will quickly find that only about 1 in 200 ferrets is so difficult that anesthesia is required once you've mastered the technique. Once you've mastered this, you will find that many ferrets require only one person to both restrain and draw blood. For the solo method, scruff the ferret and hold it vertically directly in front of you. Find the manubrium and direct the needle as previously shown. This is a very useful technique in emergency situations when a trustworthy restrainer may not be available. For performing blood transfusions, we recommend using 2 people. The holder restrains the ferret in exactly the same manner as previously described. The person doing the venipuncture also uses the exact method, except he or she uses a 22 gauge needle and a 12 cc heparinized syringe. An average 2 or 2.5 pound ferret can easily donate 10 cc's of blood. Blood typing or cross-matching is not needed in ferrets since they have no antigenic blood groups. All ferrets are type O. Although cephalic catheter placement can be done on an active awake ferret, it can be problematic and is seldom necessary. For routine procedures, ferrets can be safely sedated with a pre-anesthetic or masked with isoflurane. Sick or debilitated patients don't usually require either. For this procedure, you will need alcohol, a 24 gauge IV catheter, preferably Teflon coated, tape, a 22 gauge needle, and a syringe containing heparin flush. First, shave the anterior portion of the forearm just as in a dog or a cat. Once the leg is shaved and wetted with alcohol, the vein is usually quite visible. The vein may be held off by another person or a tourniquet, whichever method is your personal preference. The most important part of making this procedure easy is to make a small horizontal cut over the vein and through the skin using a 22 gauge needle. If you do not do this, the catheter will dull going through the Kevlar-like skin of the ferret. Once the cut through the skin is complete, the vein is easily visualized and the catheter will pass easily into it. Once you're sure the catheter is properly placed, simply flush it, cap it, and tape it as you would for any species. Adding a layer of vet wrap helps stabilize the catheter and prevent accidental removal once the patient has been returned to the cage. Ferrets seldom chew catheters and will leave them in for several days. The occasional individual that does chew can be discouraged by use of a topical paste made of metronidazole tablets and Male ferrets can be subject to dysuria either from urolith formation or from prostate disease secondary to hyperadrenalism. If complete obstruction of the urethra has occurred, emergency urinary catheter placement is critical. For this procedure, you will need a 3.5 French red rubber catheter, sterile lube, a piece of surgical gauze, 10 cc's of sterile saline, vet wrap, tape, and either suture or a skin stapler. You should also have available a 22 gauge Teflon IV catheter. The patient is lightly anesthetized and placed in dorsal recumbency. Exteriorize the end of the penis from the sheath with manual pressure until you can grasp the curved tip of the os penis. In order to prevent damage to the delicate penile tissue while installing the catheter, use a piece of gauze to stabilize it. Hook the end of the os penis to the gauze, which is then held by an assistant to keep the penis in place while the catheterization is performed. Locate the urethral opening. If you have the os penis securely attached to the gauze, this should be relatively simple. The urethra is located 180 degrees from the curvature of the os penis. Lubricate the catheter with sterile lube. Normally, a 3.5 French red rubber catheter is small enough to do the job, but in some ferrets, even this may be too large. If you are unable to pass a 3.5 French catheter, start by using a 22 gauge Teflon IV catheter. Once this is placed, the assistant can bend it posteriorly and allow you to slide the red rubber cath underneath it. Once the tip is placed, remove the Teflon catheter and slide the red one into the bladder. If urethral obstruction is caused by prostatic disease, there may be some difficulty in removing all the urine due to the presence of thick, purulent prostatic fluid. It may be necessary to milk the gland by massaging it. In some cases, the gland is so large and fluid-filled that needle aspiration is the most effective method of removing the thick exudate. An enlarged cystic prostate is easily visualized and palpated with the ferret under anesthesia and in dorsal recumbency. It is a large protuberance located at the neck of the bladder. As much as 20 cc's of prostatic fluid is not unusual in addition to 20 or 30 cc's of urine. Once the catheter is placed and the bladder flushed, the catheter may be sutured or stapled into place. Place a small piece of tape around the catheter and staple the tape to the skin. Then place 2 or 3 staples around the catheter itself. I highly recommend using staples instead of suture as it's much faster and easier to secure the catheter. The remaining length of the catheter may be then secured by use of vet wrap or elasticon tape. This is the only section of the video where you will need equipment not readily available in any small animal practice. You will need to make diluted versions of the normal small animal strengths of sedatives and analgesics. We commonly use 2 pre-anesthetic agents depending on what type of sedation is needed. For anything except adrenal surgery, we use a combination of acepromazine and butorphanol. To make a ferret strength combination, use the following formula. In a sterile 5 ml vial, combine 5 milligrams of acepromazine, 5 milligrams of butorphanol, and 4 ml of sterile water. This makes a 1 milligram per ml solution of ACE and Torb. Dose this at 0.1 ml per pound of body weight. For adrenal surgery, we use 20 milligrams of xylazine in 9 ml of sterile water. This makes 2 milligrams per ml, and dose this at 0.1 ml per pound of body weight. You will also need a face mask for gas anesthesia. A simple and inexpensive mask for ferrets can be made by drilling a hole in the end of a 35 cc syringe case and attaching an endotracheal tube end. This makes a very effective and airtight mask which fits most ferret heads very well. It's a simple task to make several of various sizes for any small mammal using 3, 6, 12, 20, 35, and 60 cc syringe cases. For most procedures, I pre-anesthetize with acepromazine butorphanol. Use it at 0.1 cc's per pound subcutaneously. I don't use atropine in ferrets as this can have unwanted effects. When I anticipate an adrenalectomy, I don't use acepromazine as it potentiates catecholamine release from the adrenal glands. If a pheochromocytoma is present or you simply stimulate the adrenal gland by manual manipulation, you may cause excessive catecholamine secretion anyway, so additional stimulation by phenothiazines should be avoided. For adrenalectomy, I pre-anesthetize with dilute xylazine mixtures at 0.1 cc's or 0.2 milligrams subcutaneously. After 15 minutes, the ferret may be masked with isoflurane. After 2 to 3 minutes at 4% isoflurane, the ferret should be intubated. During the time the ferret is reaching a deep enough plane for intubation, install the IV catheter. A set of 3.0 and 3.5 French cuffed tubes will accommodate 90% of ferrets. In those cases where an individual is just too small for these, a mask will work better than a smaller uncuffed tube. Using an extra small mouth gag, place the endotracheal tube and attach it to the lower jaw using gauze or a tourniquet. The patient is now ready for an esophageal stethoscope, Doppler monitor, or pulse oximeter. As general practitioners, we deal with animal suffering and death on a daily basis. It's sometimes easy to forget what a difficult experience euthanasia can be for an animal or an owner, even when things go perfectly. The whole purpose of euthanasia is to assist an animal in passing with as little anxiety and pain as possible. This is what allows an owner to be at peace with his or her decision. For this procedure, you will need acepromazine or a similar sedative, a narcotic euthanasia solution, and a stethoscope. If an IV catheter is already placed, by all means use it. However, if it isn't already in place, do not attempt intravenous or intracardiac injection. The trauma will be great to the animal and unforgettable to the owner. No matter how much you explain that there are few nerve endings in the thorax, it will not erase the memory of a struggling ferret being scruffed, held down, and traumatized. There is a simple, gentle, and humane way. First, relax the patient with an injection of acepromazine if time allows. I usually administer 0.3 milligrams subcutaneously. After about 10 minutes, inject 1 cc of euthanasia solution into the abdomen. This is seldom painful, and the ferret usually reacts with a minimal amount of movement. Once the intra-abdominal injection is given, the owner may hold the ferret as it peacefully falls asleep over a 5-minute period. People are usually grateful to have the opportunity to give themselves and their pet this comfort. Once the animal is in a deep coma, it is the owner's choice whether to remain with the pet for the additional 10 or 15 minutes it may take for respiration and cardiac function to stop. If needed, an intracardiac injection may be given at this point. The ferret heart is best accessed on the left side between the 6th and 8th ribs. None of us enjoys performing euthanasia, but when it becomes necessary, we have the ability to make a beloved pet's ending a peaceful, painless, and dignified one.